So how are we going to go about getting this communication down so that everybody knows what we're talking about? Well, let's start with some basic anatomical orientations. When we're talking about basic anatomical orientations, we're talking about the planes of the body that we looked at previously. And so let's start with the issue of coming off of the mid-sagittal line. That is the even division of the body. And so one of the things that we'll look at here is what is considered to be medial and lateral. So medial is going to be any indication that what we're referencing is towards the midline, whereas lateral is going to be any indication of anything that's away from the midline. Another indication that we'll be utilizing is what's referred to as proximal and distal. If we're proximal, we are closer to the torso or closer to the area of junction between the extremity and the torso, whereas distal, we are going to be something that is further away. Now, in the review packet, there's some questions and some terms where you can fill in the indications of proximal and distal. So let's think about it. My shoulder will be proximal to my wrist, whereas my wrist will be distal to my shoulder. Now, we have a couple of terms that are coming up here that sometimes get interchanged within the book, but they actually have distinct differences. When we're talking about the whole body itself, cranial is anything that is towards the head of the body itself, whereas caudal is anything that's towards the tail or the feet of the body. And the reason why we use this tail and foot, it comes from fetal development in terms of caudal development, where the feet are actually going to be growing from the tail region, but that's a whole story for a whole other day. And so when we're going to reference across different segments of the body, we're going to use large terms like cranial and caudal, as opposed to the next set of terms, superior and inferior. If we're simply looking at within distinct regions, anything that is superior is vertically above. Anything that is inferior is vertically below. Now notice I said vertically below and vertically above. So if our patient happens to be lying supine, the indication of cranial and caudal never changes. However, the indication of superior and inferior will change. That's why we have to be very careful with which term we're going to use as it relates to the orientation of the body. Now there's some other orientations that we'll be looking at here. And so some of the other orientations that we're looking at is, once again, differences between whole body versus a small segment of the body, ventral and dorsal. Ventral is always to the stomach side. Dorsal is always to the vertebral side, and it's off of the coronal plane. Now, there's another reference that we can use if we happen to be looking at a small segment of the body, and that's going to be anterior and posterior. Now, anterior and posterior is the indication of the same thing, towards the front or towards the back. But instead of looking at it in terms of the whole body, it's looking at it in terms of just that one little spot. Now, once again, to the front, to the back can change. If, once again, we're looking at a patient who is supine and we happen to be standing towards their head, the cranial side will be anterior to us. And the foot side will be posterior to us. And so we have to be very careful with how we're using the dorsal, ventral, anterior, posterior, where in the book, it will tell you that you can interchange ventral and anterior, but if I change the way in which the body's positioned, I automatically change those reference orientations. Now, another one that comes into play here is what's referred to as the surface references. And the surface references are given basically two general orientations. There's a third, it's not listed here. There is what's referred to as superficial and deep. Superficial is anything closest to the surface. Deep is anything that is further away from the surface. Anything in between those two extremities, anything that's in between superficial and deep is automatically intermediate. And so intermediate will have a whole list of things that are intermediate. It's just, it's not the most superficial and it's not the most deep. So if we look at, say, the lower extremity that we have here, the bones, the femur, the tibia, and the fibula are the deepest of the structures, whereas the integumental system, the skin, in particular the epidermis of the skin, is the most superficial. Anything in between those two extremes will be intermediate. But if we're looking at, say, just the muscles of the curl region to the shin, the front of the leg, will be superficial to the tibia and to the fibula. Or the quadriceps muscles will be superficial to the femur.